Hi, I'm Dr. James Machino. Let's talk about what are the best arthritis treatments. Well, there's two types of treatment really. There's medical treatment, and then there's sort of lifestyle, natural medicine treatment. Let's talk about medical treatment first. In terms of controlling the inflammation in arthritis, there's non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, Voltaren or diclofenac, indomethacin. Then there are also painkillers, things like acetaminophen and stronger narcotic drugs. And then in autoimmune diseases like rheumatoid arthritis, there are also these drugs called tumor necrosis factor alpha blockers or TNF blockers. And also drugs that are anti-metabolites where they interfere with the ability of the white blood cells from reproducing so easily. Drugs like methotrexate, because in autoimmune diseases, certain white blood cells are producing inflammatory chemicals and antibodies that are destroying the tissues. And then, of course, there's prednisone and these corticosteroid drugs that act as anti-inflammatories. So the drugs work, and thank God we have them. The problem is that as you take them over a long enough period of time, it doesn't matter which one we're talking about, you run into adverse side effects. They all have adverse side effects, some of which can be life-threatening if you stay on them too long. So what I like to do for patients is teach them the lifestyle and natural medicine things they should be doing at the same time to help reduce the reliance on prescription drugs and over-the-counter drugs, so that will decrease their total lifetime exposure to some of those synthetic agents. So what are the best treatments for arthritis from a lifestyle standpoint? Well, for osteoarthritis or degenerative arthritis, the best thing you can do is use glucosamine with natural anti-inflammatories. We'll talk about that. For rheumatoid arthritis, you want to try to tone down the body's immune system hyperactivity. It's producing so many antibodies and so much inflammation, it's destroying the tissues. And that's the same. The same is true for lupus and psoriatic arthritis and other autoimmune diseases that affect the joints, like even Reiter's syndrome, for instance. So in osteoarthritis, we used to think it was a wear and tear type of arthritis, but really what we're seeing is the hallmark feature is after the age of 40, we all stop making optimal amounts of glucosamine, and you need glucosamine to make joint cartilage. And so if you don't have the glucosamine that you need, the cartilage will break down at a faster rate that you can build it up again. And that's what you see on an x-ray. You see a thinning of the joint space. As the bones get closer together, there's less cartilage there. For a long time, nobody knew why this was, but in the 1980s, someone figured it out. Since then, people have been taking glucosamine supplements, and it's been showing it can stabilize the joint cartilage. That's very important. The other thing that happens in osteoarthritis is that there's sort of like saran wrap around our joints, and on the inner lining of that saran wrap or synovial fluid, there are immune cells called monocytes. And as we get older, those monocytes secrete more inflammatory chemicals, which cause pain and inflammation. So it's not all about cartilage destruction. So if you can sort of suppress that inflammatory response, that's also very helpful. That's why I like patients after the age of 40, even to prevent osteoarthritis, to use some low-dose glucosamine supplementation in conjunction with anti-inflammatory herbs like MSM, quercetin, and bromelain. Taking chondroitin sulfate is totally useless, by the way. It doesn't even get absorbed. And when you do that in conjunction with an anti-inflammatory diet, it's going to decrease the likelihood that osteoarthritis will occur. And if you have osteoarthritis, it'll help to manage it much more effectively. For rheumatoid arthritis, you're trying to tone down this immune system that's sort of hyperactive and secreting all these inflammatory chemicals. And there are also nutrients that create what's called bioregulation of the immune system. That means helping to balance out the immune system so it cooperates with the body in a more justifiable way. So how do you do that? Well, of course, you need an anti-inflammatory diet again. Natural anti-inflammatory herbs like curcumin, boswellia, white willow bark extract, ginger, even quercetin. Higher doses of vitamin D regulate the immune system and have anti-inflammatory effects. Medicinal mushrooms and astragalus help to modulate the immune system, bioregulate it. Probiotics can do that to a certain degree. See, what's frustrating for me is that many family doctors, rheumatologists, orthopedic surgeons fail to explain to arthritic patients that these lifestyle and natural remedies can be used along with the medications they prescribe. And so that's sort of where I come in. The best thing that you can do to understand all of this is to download the ebook that I created called Proven Natural Remedies for Joint Pain, Arthritis, and Inflammation. It's available right here. You should download it right now. The booklet explains the exact lifestyle program you should follow if you're an arthritic patient of any kind that'll help you better manage your condition in conjunction with whatever drugs or medical treatment you're undergoing. Every single arthritic patient should have a copy of this ebook, Proven Natural Remedies for Joint Pain, Arthritis, and Inflammation. So, download it now, or if somebody you know has an arthritic condition, download it for them. Now at machinohealth.com, you'll see my other review papers, videos, footage from my live professional seminars, other resources and downloads I've created that are free to you, that contain all of the information that you need, or a lot of information that will help you lead a long, healthy, functional life. It's not enough just to be alive, you want to be functional. All my review articles and teaching materials come complete with all the scientific references to make sure you're getting only evidence-based information on any health topic that you're looking for. So make sure that you use machinohealth.com as an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.